So as far as I'm concerned, or as far as I know, there isn't necessarily even a policy in place. If it is just you can't smoke, people aren't listening to it.
It sounds good, but there's nothing really being done.
Tell me, how many people do you think out of 10 smoke? At GW specifically.
Out of 10?
Yeah.
4?
Do you think a lot of people recognize that it's not good for your health?
Yeah, but like I think it comes with like kind of peer pressure and like cultural phenomenon, and just like cultural pressure to like do it at parties and to make friends at college and stuff. That's why most people would do it, especially our age, young adults.
Cool.
As a GWU student, we've seen that there are definitely some problems with smoking, and while we claim to be a smoke-free campus, we're definitely seeing that it's pretty prevalent all around. Even though smoking is becoming less and less prevalent, still 30% of college students have reported that they smoke, and we've also seen that e-cigarettes are taking that place of smokers. We see it in many places on campus, and there doesn't seem to be any kind of policy that GW is implementing to eliminate the smoking.
How is it an issue?
Lynn, so tell me, how is smoking an issue right now, and where do you see it specifically an issue at GW?
So, smoking is obviously a public health issue with its effects with the smoke on your lungs and the tar that's in the cigarettes, to the nicotine that's addictive. So the problem with it on the GW campus is that there are a bunch of students who now are kind of out on their own, trying to be social. I feel like the whole social environment causes people to engage in activities that they wouldn't necessarily engage in before. So smoking is one of those things that becomes an extremely social event where people are just hanging out in the back at the party, and you're just like, oh, you want a cigarette? And people will just kind of slowly get introduced into this problem.
Almost as if they don't see the major public health issue in it, but it's kind of a social event, and then it cascades from there and it becomes an addiction.
Alright, so obviously you smoke. We just wanted to know when you started smoking.
Freshman year.
How often do you smoke now? Like daily?
Like about half a pack a day.
Half a pack a day, okay. So are you a student here at GW? Are you a senior?
Graduate student.
Okay, I know, so our campus is technically a smoke-free campus. Do you have any input on that, or how do you think we
see, because I also did undergrad here, and I was around when that became a rule. And
it wasn't.
It wasn't for the first 2 years here. It wasn't a rule, and they did a slow implementation thing where there was a year where it wasn't technically enforced, and then now they enforce it. I think it's silly because we're in the middle of the city, and you can't really enforce anything because it's streets. Do I follow the policy? Absolutely not, but
yeah, I think that they should probably have more people around. I think they should probably enforce it more. I think that they sometimes turn a blind eye to it, so if they could have more police officers around some of the more important buildings that people are at a lot, I think would be really helpful.
Has a cop ever come up to you and told you to put it out? Or?
Yeah, a couple times a day.
They just tell you to put it out?
Yeah, they ask you to move, and then sometimes I listen, sometimes I don't, depending on the cop, because there's some red lights.
First off, have you ever seen anyone smoke by those signs? And then second off, what has anyone done? Has GWPD ever done anything to solve that?
Yes, they are smoking right next to the signs, especially the Duquesne Funger area. And I've never seen GWPD talk to anyone who's been smoking.
So essentially we're aware that smoking is a problem on our campus and around college campuses across the nation, but we kind of have a fake set up way to attack it or to go at it, right?
100%.
Yeah.
Usually I've spoken to them about it, because usually when you have a smoke-free campus, you'll have smoking areas.
Yeah.
Because sometimes, they'll ask you to go to the sidewalk that's full of people as opposed to up here when there's no one around. So if the idea is to help people avoid it, then putting you on the sidewalk where everyone's walking kind
So-
of defeats the purpose.
So if you are a smoker, there's no like, you're just not supposed to. There's no like alternative to it.
But because we're in the city, you could just smoke on the sidewalk,
Yeah.
and absolutely nothing anyone can do about it.
Because so that's technically not the school's property. Right?
Yeah, it's DC.
Yeah. Have you seen anything? What do you see about like vaping and how that popularity is going? Do you notice that, or do you see that around campus a lot? Or
Oh yeah, I mean like the Juul or whatever has been like taking off, and like people smoking in class all the time, and like e-cigarettes. Like it almost seems like that's more popular than cigarettes among our people our age. But I guess it's a healthier alternative, but it's still not good for you. And like wish people didn't do it. I don't
makes
do it.
sense. Makes sense.
As students become more exposed to vapes and e-cigarettes, we are concerned that the more they use this, the more likely they'll be exposed to smoking as well. According to the NIH, about 30% of young adults will start vaping, and within 6 months, they will begin smoking cigarettes.
I used to be super judgmental of it when I was in high school and people started doing it, and then I started doing it every once in a while, and then when Juuls came out, I heard there was a lot of nicotine in them, and I was like, oh, that's bad. It's definitely not safe. Like, nothing now is 100% safe for your body, but it's definitely a lot better than cigarettes. I know there's a lot of debate going on that the chemicals in the e-cig juice or whatever also are not that great for your health, but it's definitely a lot better than cigarettes that have rat poisoning, cat pee, and whatever else people say is in them.
What are your thoughts on alternative forms of smoking, like Juuls or vapes?
I don't like them. They make me cough. I really don't like them. Yeah, probably really unhealthy too, honestly.
They're technically supposed to be healthier
They're
than...
not. Like, there can be, right? The thing is, because the cigarette people are heavily regulated, like at least, these people, no one knows what they're putting in their stuff, so, it's not for me either. I don't like to, charge it and it's too much work.
After speaking with many students at GW, we have found that GW's smoking policy is mostly ineffective. There's a lot of general confusion and not a lot the policy is being enforced. We've noticed that there's an increase in the use of vapes, Juuls, and other forms of e-cigarettes, and that's a little bit concerning to us because not a lot is known about the health risks of these new e-cigarettes, and they're not really regulated by the university. All in all, it will be interesting to see if GW creates new policies to accommodate the influx of smokers on campus and what they will do to protect the health of non-smokers.